Today, we visit our emergency response team in South Sudan. Medair is responding to increased health needs following a local conflict in Tambura, a remote county near the border with the Central African Republic. With our long-term partner Mission Aviation Fellowship, we bring in essential supplies. Isaki is our pilot for the trip. His childhood dream of working as a pilot has come true.
We are actually the one who helps those who help others. And I think it is beautiful that I can surf and fly airplanes at the same time. And it's like a perfect match for me.
Medair specializes in providing emergency relief in remote and hard-to-reach places, and Mission Aviation Fellowship's pilots are experts at using their aircraft to fly aid to such places and to land safely in places with poor infrastructure. Our colleague Jonathan is relieved that the supplies have arrived safely. What he and his team urgently need now are rapid tests and medicines to treat malaria. On the way to our clinic, Jonathan explains the situation.
The Medair emergency response teams deployed in Tambura to respond to the alerts of IDPs coming from around Tambura within the towns because of the conflict that has happened in Tambura. We identify there is a gaps in health. The hospitals and other health facilities were vandalized, also make access to facility become very difficult, and essential drugs were not also there.
Jonathan shows us around the Medair clinic. We see patients of all ages here. Many patients come with symptoms of malaria and are tested and treated if they are infected. In our emergency unit, we stabilize patients or transfer them to the nearest bigger health facility if necessary. Our team provides antenatal and postnatal care and transfers mothers to nearby hospitals for delivery. We also provide basic vaccinations for children and assess them for malnutrition. Children found to be severely malnourished are referred to a partner nutrition center for treatment. Rachel is one of 20,000 people forced to flee with her family during the recent fighting.
I came here because of the conflict. The enemy came at night and attacked us. They wanted to kill us. That's why I came here, to be safe.
Only a plastic sheet, stretched over a makeshift structure of sticks, gives Rachel and her 9 children some privacy and protection from the extreme weather in Tambura.
It is very uncomfortable for us to sleep here. It's too cold, and when it rains, the water gets into the tent. But I'm too scared to go home. We could get killed.
Rachel and her youngest daughter Emma are sick and come to our clinic for help. All medical services are free of charge.
That's because we sleep in the cold. That's why we get sick. The child has a cough, diarrhea and vomiting, and her body is hot. I have a bad headache and cough. My eyes are red and watery when I cough.
After the examination, Rachel is given medication for herself and her daughter. This should make them both feel better quickly. They both have a follow-up appointment in a few days.
I know that Medair has been doing a good job since the team started working here, providing free medicines and referring people to the nearest clinic for serious cases. I came here because it was the closest place. If the drugs weren't free, I wouldn't have the money to buy them. I am very happy they are free.
When we see children suffering, we feel like, yes, the little that we are providing is really making impact. And we are so happy to see that what we are giving is supporting the community, and the community is appreciating it. And then we also physically see the impact that people are really getting well after receiving treatment. And that is something very important.
The security situation in Tambura has improved, and many families have returned to their villages. Our team recently handed over the medical services to a partner organization. This means that the services will remain in Tambura, and Medair will be able to move on to a new emergency elsewhere in South Sudan. We look forward to updating you, and thank you for your continued support.